Welcome to Pulse Check. We have quick conversations about how to help people in Alabama live healthier lives. Today's guest is someone who has spent his career working behind the scenes to make a real difference in the community. Tommy McKinnon serves as Vice President of Community Engagement for Baptist Health and Executive Director of the Baptist Healthcare Foundation, where he leads efforts that bring communities together through outreach and philanthropy to support patients and families in meaningful ways. Tommy has more than 30 years of experience in marketing, public relations, and healthcare communications. But what really stands out is his heart for service. Whether it's supporting families through programs like the Neonatal Intensive Care Unit, also known as the NICU, and hospice care, helping expand access to resources, or giving back through countless community organizations, his work is about people. He also is just an all-around interesting person. He's a published novelist, a musician, and an avid sailor and golfer, which makes this conversation even more fun. I'm really excited for you to hear from Tommy today as we talk about the impact of community health and how that work often leads to impact behind the scenes. So first question, Tommy, when people think about healthcare, they usually think about hospitals and doctors, but what's happening behind the scenes in community that most people don't see?
Well, Angie, first, let me say thank you. It's great to be with you today. When most people think about Baptist Health as a large health system, they oftentimes do think about our three hospitals, but actually we're made up of nearly 40 different outpatient facilities as well. And they're a large family. We've got over 6,000 team members. So I think it's important to really recognize that our organization is intricately threaded throughout the entire community, and not just that of Montgomery, but of the 17 counties is really our service area. So not only do we work in those areas, not only do we live in those areas, but we're constantly in service trying to bring healthcare outside of the walls of the hospital and into the community where we serve.
Wow. So I didn't even know that. So you serve 17 counties in and around central Alabama. That's incredible. Well, what are some of the biggest gaps that you see, day to day when you're talking to people, or even the biggest needs that people are having right now in our community when it comes to healthcare?
Well, if you live in Montgomery, Autauga, Elmore counties, you've got pretty good access to healthcare. I mean, we've got a lot of services, not only through Baptist Health, but all the affiliated physicians in the area. There are a lot of different outpatient facilities that serve as well. But as you get out into the more rural areas, those services get further and further extended. And so, one of the things that we started doing just a few years ago, we raised money through the Baptist Healthcare Foundation for first a mobile mammography unit as part of Montgomery Cancer Center. It's an incredible service that basically allows us to take a mammography ultrasound unit. I'm
Wow.
going to back up on that one. Just a few years ago, through the Baptist Healthcare Foundation, we raised significant funds to purchase the first mobile mammography unit for Montgomery Cancer Center. And this allows us to take mobile mammography out into the furthest reaches of our service area and
Wow.
to provide scans for people who may not be able to either make it to a physician in the Montgomery area, to the Montgomery Cancer Center, or who just maybe happen to be behind on their regular checkup. So that's been an incredible service that we've been able to extend. And of course, we partner with all the 17 counties to be able to take the unit to some areas that are extremely rural. And we've had such incredible and really life-changing results that have come from that unit.
That is incredible and amazing. And speaking of that, is there one story that might jump to mind? And if not, that's fine. But can you think of one particular situation that you've heard really helped a person in a community and it meant so much?
So I'm so glad you asked that question, Angie, because this has just been a really remarkable service. Not only do we have the mobile mammography unit, but we also have, and the mobile mammography unit is called Joy. We also have a different unit that, while it doesn't have mammography on it, it does provide education to area schools, businesses, civic organizations, but also it has the ability to take a nurse practitioner on board and to provide observational screenings. We were just at the Barbour County Wellness Fair this past weekend. I've just received this report this morning that they did 33 cancer risk assessments in 4 hours to the participants at this wellness fair. One went on for a skin referral. There were 4 colonoscopy orders, 3 color guard orders, 2 diagnostic breast evaluation referrals, 1 diagnostic mammogram, and 12 mammogram orders, 11 which were performed on the Joy bus on site that particular day. So
Wow.
yeah, there's really great things that are happening with these 2 units right now.
And those are examinations that may never have happened had the Joy Bus not been there and been in the community and working with those community members. So
That's
that's
exactly right.
amazing. That's amazing. Well, in addition to that, programs like the NICU we talked about earlier, the NICU Fund or hospice, that kind of support goes beyond traditional care. Why are those kinds of resources so important?
Well, you think about a family that's going through a crisis, and while that could be either with the birth of a child that is arriving a little early or perhaps isn't fully developed, or it could be an end of life type situation. And we're fortunate that we have both services to be able to offer families. On the NICU side, we have state of the art technology and the largest NICUs that are in the central Alabama. We're able to care, and we do care for more neonates than any other provider in the area. We
Wow.
have extraordinary technology, which is obviously provided by Baptist Health. And from time to time, the Baptist Healthcare Foundation, through our events and fundraising, are able to offer some additional funds that allow our two NICUs at Baptist East and Baptist South to ensure that they've got not only the highest and state of the art technology that's available for our tiniest and most fragile of patients, but also to help to improve the environments that those patients are going to be served in as well. It was just this past year that while we had a great NICU at Baptist East, we actually built out a second unit because of the increased volume over the past few years. And that unit has extraordinary technology. It's a beautiful environment as well. And we were able to, through the Baptist Healthcare Foundation, help provide some additional technology there as well. And I'm happy to say that just a few weeks ago, Baptist Medical Center South received 5 state-of-the-art giraffe beds. These are really high-tech isolates that babies are warmed in and that they reside in under our care. And so we were able to provide the funds to help them purchase 5 of these. So it's pretty exciting. Now that's only on the NICU side. On the also on the hospice side, it's even more important when a family is dealing with a family member that's at end of life and they may not have the resources to be able to provide the necessary care. But I'm happy to say that also through the Baptist Healthcare Foundation, we're able to provide some supplemental funds to our Baptist hospice program that allows patients who are underinsured or not insured at all to be able to receive that same warm, compassionate care that all patients do.
I think warmth and compassion and comfort, like you were speaking of earlier, sums up my experience have always been. I remember even back when I was having children, everybody said that's where you want to have your babies because you made sure that everybody was comfortable, whether it was the birth person, the birth mother, or her family, whoever was there, the biggest suites at the time. And like you mentioned, the technology. So that definitely has been my experience as well. Thank you for leading that.
For sure. Well, to your point, you deliver more than 80% of all babies in Central Alabama. So
Wow.
we know how to deliver a child. There's no question about that. We hear so many wonderful stories of parents who have delivered their children at either Baptist East or Baptist South and have had such incredible experience.
Well, that certainly has been my experience. Thank you for sharing. Well, you mentioned technology, but my next question was, are there any new initiatives that you're really excited about? Like what's going on, whether it's technology, whether it's another event or something that you guys are doing, something that you're bringing to the community? Can you share with us a little behind the curtain of what's on the horizon and what you're excited about?
Well, I'll mention 2 things. One, yes, we're planning a new event, but I'm not ready to quite talk about it today, but it's going to happen in January. And I promise you, it's going to be a big deal. But I will also refer to our most recent event, which is Birdies for Babies. And we just held it a week ago. And it was incredible. And we had the best weather possible. We had the most participants ever. We had the most sponsors that we've ever had before. And we raised more money than we ever were. It was a record year. And Birdies for Babies is a 2-day 4-round golf tournament. There's not another one like it. And
Wow.
we raised just over $215,000 that go directly to our NICUs to be able to afford that state of the art technology that we've already talked about. It was a great couple of days.
That is an amazing event. And remind me, how long has Birdies for Babies been in progress? Like 20
It's
plus years, right?
31st year of Birdies for Babies.
It was
So
the third.
it's really remarkable that an event can last that long because so
Mhm.
many of them eventually peter out. we like to think that we create a tournament that brings exceptional value to our sponsors, exceptional value to the people who participate in it. They love the event and the kind of the how grand it is, but also I
Good.
believe that people have a true care for the purpose behind that, and that is to
Right.
truly take care of the most fragile patients that we serve.
Absolutely. Well, congratulations. And you are getting ahead of my questions, which is fine. But my next question was, what's a recent win you've had over the last 6 months that you haven't publicly spoken about yet? So if you want to go with that as your answer, or if you want to share something different, the stage is yours.
Well, I'll tell you, during that event, there was something that was kind of special that did occur. At Birdies for Babies each year, we like to bring in some NICU ambassador families. These are families who have had a child or children that have been treated in our NICUs, and they have remarkable testimonies that they're eager to share. And so before each one of the rounds of the golf tournament, we bring one or two families in to talk about, and helps us to connect our golfers with the reason that they're there, helps them to understand where those dollars go. And this past week, we had such a remarkable story that was shared by somebody that many people will know, Sarah Beth and Lucas Tribble. Lucas is with First United Methodist Church in Cloverdale. And he and his wife had two babies that were born in August of last year. And they, each of them made it to 38 weeks before being born. And while both of them were not necessarily in the NICU, their son Sawyer was. And Sawyer uniquely benefited from a new cooling technology that was purchased specifically with the funds from Birdies for Babies. So it was neat to hear Lucas Tribble talk about that experience. Of course, he brought both of his children out. He and Sarah Beth brought both of their children out, showed them off to all of the golfers, and shared this story with them. So, yeah, there's stories like this that happen every single day, and I'm not talking about one. At any given time, we might have 30 to 60 babies in
Wow.
ICUs. But there's a lot of love that's going on at that time. But there's a lot of blessing that comes out of that, because these children, while they're frail and while they're really against kind of an uphill battle in many times, they're also fighters, Angie. They are fighters and they are survivors, and we have seen them not only graduate from our program but grow up to be remarkable people themselves.
That's amazing. What a wonderful story. And that's cool that you get to hear from people all the time that have really benefited from the hard work that you and the golfers and the sponsors are all doing. So from babies to the future of medicine, you invest a lot in scholarships and workforce programs. How do these play a role in the future of healthcare?
Well, Angie, I think it's first important to note that it was about 53 years ago that the Baptist Healthcare Foundation was originally developed. And it had a very specific purpose when it was launched, and that was to raise money to provide scholarships for nursing students at the time. Well, here we are 53 years later,
Oh,
and there's still a shortage of nurses. So we're still working very, very hard to to identify potential donors and to raise funds that allow us to not only provide a few, but significant number of scholarships to nursing programs, to medical school programs, to allied health programs. And so we don't just start with graduate and postgraduate type scholarships. We've got opportunities that begin when students are in junior high and high school, teen volunteer programs with our Explorers program, where they're able to get exposed to some really neat medical and clinical opportunities, learn from experts that are in the Baptist healthcare system. But ultimately, when they do get to the age of scholarships, we've got so many. And I'm excited to say that just a couple of weeks ago, we announced all of our new scholarships for 2026. These will be awarded for the 2027 school year. And we are giving out 65 scholarships. I'm sorry, 62 scholarships for a total of $202,000 this year, which, as far as I know, is more scholarships in the healthcare world than anybody else is giving out at the local level.
wow. That's amazing. And these will be the folks that will be taking care of us for years to come.
That's
That's
exactly right. And
awesome.
you mentioned workforce programs as well. So we partner with the Boy Scouts of America to provide our Explorers program. That's a great opportunity for teens, in addition to the teen volunteer program. But we also partner with the Impact Healthcare Program it's located at Montgomery Mall, or what used to be Montgomery Mall. And that's just a pathway for students to go on after the graduation from high school to seek all kinds of different medical and allied health type opportunities. Excuse me. Pike Road also has a wonderful health science program that we're a big part of as well. We're trying to steer and and attract students at a very, very young age. If we feel that if we can get introduced to them while they're in high school, we can continue to follow them along their career. And whether they wind up being an extraordinary nurse one day or a physician, we still have a home for them when they're ready to settle in the Montgomery.
That is wonderful to hear, especially as somebody who resides in one of the 17 counties. I definitely want to make sure somebody will be able to take care of me and my mama for a long time to come. Well, after 30 years in this field, Tommy, what keeps you motivated to continue this work?
Well, it's a great question, Angie, but it always starts with people and relationships. And I will tell you, I mentioned 6,000 team members of Baptist Health. It's extraordinary the work that our people do within the walls of our facilities. And while I was a son of a surgeon and a emergency room nurse, actual healthcare roles were not something that I was blessed with nor had a desire for it, but I wound up in the industry even so. And the great thing about healthcare is that no matter if you have a mind for math or you have a mind for science or you have a mind for writing or pretty much anything, there's a place for people in healthcare. And so I've had the great benefit over 30 plus years to work alongside of some of the brightest, most creative and talented minds I believe that exist across many, many different skill sets and professions. And it makes it a pleasure to come to work every day. But what even is better than that is seeing the successes that come out of having people with extraordinary and sometimes simple healthcare needs, but have their needs met at the local level where they don't have to travel to Birmingham or they don't have to travel to Atlanta or another big city. They can find that expertise right here at home by extraordinary people who truly have a desire to care for people and have an unlimited supply of compassion for others.
So it's just like the people,
And
like we talked about in your intro. You just have a heart for people. Well,
thank
the
you.
last question then would be from me is if there was one thing that you wish the people of Alabama understood about their local community hospital foundations, what would it be?
8 years ago, when I stepped into the role of executive director, I had a unique opportunity to review all of the meeting minutes from 50 years of the Baptist Healthcare Foundation meeting. And what surprised me was that the very beginning of Baptist Health, and specifically Baptist Medical Center South, which was back then Montgomery Baptist Hospital, is that the original funds for that building were seeded by area churches and Sunday schools. And so, what I think is remarkable about that is that in 1963, when that hospital broke ground, excuse me, when it opened up, that there was a perspective about hospitals and healthcare as being a health ministry. And somewhere along the lines, we've lost that.
Mm,
And so my main goal right now is trying to help people understand and re-embrace the fact that healthcare is a ministry and that it's an
mm.
opportunity for people to share their resources in order to help other people heal. And so I think that's a unique part of being a part of this community. A lot of people love to give to higher education, and there are hundreds of really well-deserving nonprofits in this area as well. But we like to think that at Baptist Health, and specifically the Baptist Healthcare Foundation, that we provide something that's really, really unique, and that is the opportunity to help build better healthcare services that won't just have an impact today, but for generations to come. It will help to recruit some of the brightest and talented minds for healthcare roles now and in the future. And it will help us to continue to deliver exceptional quality in an expanding service area day after day after day. And there's always that opportunity to give on BaptistFoundation.org. So thank you for asking that.
I love that. Healthcare is a ministry. We're literally called to look after one another. So that's a beautiful sentiment. Well, thank you for sharing your perspective today, Tommy. I've enjoyed the conversation and I appreciate your time. Is there a website where somebody can learn more or more about your work or how to get involved?
We always like to direct people first to BaptistFoundation.org. That will provide an overview of what we do in the foundation, much of which I covered here today. But it's also a great way to make an online donation if somebody has a particular affinity for one of our programs, or of course, our phone number's on there, and there's an email opportunity as well to reach out to us if they have a particular passion project that they would like to work on as well.
Awesome. And then we'll all be waiting with bated breath to find out what is happening in January. I'm super excited.
Well, I can't wait to come back and talk about that in the near future.
Well, you have to come back and tell us more when you get to that point. But if anybody wants more information on Pulse, it's a health resource guide for the entire state of Alabama. You can definitely check out our website at alabamapulsemagazine.com. And if you have any ideas about who we should have on next as a guest or what a topic should be, please let me know in the comments. And Tommy, you're certainly free to share any ideas of who we should talk to next as well. But thank you so much for being here.
Thank you, Angie. I greatly appreciate it.